Hi, happy Friday. It's Dina the dietitian, Dish with Dina, continuing on my next and last vlog of this week in the life of me. I've shared with you what it's like to be an adjunct lecturer, a registered dietitian, a private practice owner, and what else did I do? Nutrition consultations for the Head Start program. And so today I am wrapping up this week. What I wanted to share for today, so I'm currently in kind of like loungy clothes. I only had one patient and I've been working with her for so many years that we know each other very well. And I messaged her before our session began and I said, I'm probably going to be in my pajamas without any makeup on because you're my only person, and then I have to run errands and do some house chores, etc. Because as I mentioned earlier this week, I am staying with my mom and I'm helping her out with stuff that she's doing here. So the reason why I bring this up is because normally, I'm going to be quite professional and I take my job very seriously, but I mentioned earlier in the week of self-disclosure, of how that plays a role. And this person knows a lot about my life, not every single nuance of it, but the fact that I'm with my mom or I travel to New Jersey every so often. And we have a lot of things in common and we know each other through some other ways as well. So, again, we've been working together for years. So I feel very comfortable saying things like, I need to just chill today. Do you mind if I come kind of like casual, versus feeling like I have to put on a face and present myself in a more professional way when I'm not really feeling the vibe. So I very much appreciate being able to work with people like that. The thing that I want to kind of discuss around that is the mutually beneficial relationship when we're working in more of a patient-centered care approach. Because as I share with my students all the time, we're not speaking at or to our patients. We are speaking with them. We're speaking as part of their support team. And they also know their bodies best. They know their lives best. They know what experiences they've been through before, what works, what doesn't work, and we're there to help bring things out. So I never feel like I'm there just to tell somebody what to do. Instead, I'm there to extract what they believe works best for them and then help them strategize a way that feels sustainable, manageable, and however convenient it is for them to be able to implement. Otherwise, they're not going to be successful at trying to manage their conditions or create healthy habits for themselves going forward. So that's it for today's front. I'm done with that patient session, and that's what I wanted to share there. There's so much to do today that I want to walk you through a little bit about some of the administrative things as well. When it comes to running your own business, in our profession, we also have to maintain quite a lot of things that require us to spend money or time or energy on. So we have to do professional development, accumulation of units to keep our license and our credential active and valid and legit and current. And then we also have to do things like maintain, liability insurance and all of the subscriptions and renewals and newsletters and emails and correspondence and all of the other things that are not the super sexy part of what we do. So I'll take you on a little bit of a journey on that as well, share some of my systems and how I work on that in a week in the life of me.
Every week or every other week or once a month or once a quarter, however my deadlines guide what I'm about to do, I have to set aside time to work on admin things. So I'm going to take you on a little bit of a tour from left to right here of a week in the life, a day in the life, whenever these ad hoc moments come up of when things are due. And I'm going to be very transparent as well in sharing with you how much some of these things cost me, because as I mentioned, I think in one of the last vlogs, part of, at least for the dietetics profession, we have to abide by a scope of practice. And one of the things in there is continuing education units. So we have to make sure we are staying current and attending things like webinars, research, conferences, etc. Some of those things are costly. As an entrepreneur, where I have my own part-time private practice and I have my branded Dish with Dina name, and the way that different states work and different credentials and professions work is sometimes you could just act as your own person. You can use your own name, social security number, and you're fine. Other times you have to make sure that you are considered a known business entity. And again, this has to do with either tax purposes, or in our case, billing and coding purposes when we're working with insurance companies. The last thing are all like the superfluous stuff. So as I said earlier, like subscription costs of stuff. If I want to be a member of a particular organization, how much that's going to cost me. If I'm working with different companies and entities that hire me as an independent contractor, sometimes they have different portals that I have to get set up on. And I'm not necessarily paying for that, obviously, but it's time and energy out of my day, and I have to follow a whole different train of logistics when I am working with those different organizations. So I've written down some notes for myself to share with you as far as administrative tasks and license renewals and insurance credentialing and how the career is run. So a lot of, again, I think the theme for this week is moving parts. Now, not for the faint of heart. If you are planning on going and doing this on your own, just, take it to consideration, set aside some time. In addition, when I am working with my patients, when I'm in my actual patient or client sessions, I still have to set aside time to do the progress notes, the charting, the follow-up in between my sessions, especially as I shared, I think the other day, with insurance and number of sessions that somebody might be eligible for. If they're not meeting with me every single week or very regularly, I do check-ins with them in between. So again, I'm carving out time on my schedule to make sure I'm doing that. And then I have to carve out time when they receive the check-in and they answer me back. And sometimes they have questions that could be a little lengthy. My general rule of thumb for that is if I can answer something in about 5 minutes, I will just quickly through the patient portal. If I cannot, then they need to set up another appointment with me, or I will have to wait until we have that appointment that I can go a little bit more into detail. So from left to right here, you have 1,000 open tabs, and I'll share with you, like I said, kind of the cost and why I use this. This is a Dropbox account. This is for large files and easily accessible things that I can share with other people who I might want to send things out to, or just keep a library of my downloadable stuff outside of something like Google Drive. I do pay for a Google account that has extra memory and storage to it, but I prefer this as well. So my Dropbox account is about $120 a year. And again, you can see all the different folders on here. Some of them I'll just have a link to. So for example, the Department of Aging, I have all of my PowerPoint presentations in here, and sometimes I do handouts for the attendees when they attend my webinar, and they also want to have access to this because it's part of my contract. So it's not just me facilitating the presentation, it's also providing them with the materials. So I'll create my PowerPoint presentation, I'll turn it into a PDF, or if I handout, etc. And then I'll put a little link on here. And when I confirm and complete my transaction and I send my invoice to them, then I put these links that they can go ahead and download that on their own. Next up is Zoom. So this is my Zoom account. Obviously, I'm in it right now while I'm talking to you, because I figured it'd be easier just to do it like this. Holding the camera on my phone and bouncing up and down, that was making me a little uncomfortable. So in here, you can see there's plans and pricing, and I opted to go for a Zoom Pro account because I do hold monthly webinars. I do sometimes do workshops, and I used to do like this yearly virtual wellness retreat where there were hundreds of attendees. And as you can see with the basic free plan here under Zoom, they limit you to the amount of minutes you have. They limit you to the amount of participants you have. And there's some other limitations as well here. So I like the flexibility of having the pro. I can't right now go as high as the business. And this is still just what's known as meetings. This is not technically how Zoom categorizes their webinar. The webinar is where the participants can't be seen at all. And ideally, I would love that, because I record all of my webinars and I post them to my YouTube account. So I have to go out of my way when I'm doing my editing to block out all of the names, because I don't want people's names and, or faces if they open up their cameras. Sometimes there's children that show up on these things too. So I want to make sure it's safe and secure for anybody who is attending. So I have to go in and physically create a block shape to cover that section. So there's no other way I can do that. If I had the money, which is, like 10 times the amount of what they're charging me here to do a webinar, maybe one day I'll do that, then I don't have to worry about that. So my Zoom account is it comes out to about $150 a year. Next up is Canva. Canva is something I didn't think I was ever going to use, because I was a standalone OG PowerPoint gal, but then somebody introduced me to Canva and I was like, oh my gosh, my world has changed because I love, love, love all of the templates. The issue with Canva is they have a free account and that's great, but they also have a pro version. Everybody likes to upsell you. So my Canva account comes out to about $120 a year here. And what I like about it is a few different things. Obviously, there's a variety of templates. I can customize some things. I can download and I can utilize some of their features and their art that's in there that people without the pro account cannot use. What I also have liked about Canva is they have printing now. That wasn't a thing back in the day, but now they do printing and flyers. And I even printed a t-shirt from them too. So they're a bit costly. Like I wouldn't necessarily, if you're doing mass production, like bulk items, I would probably say it's not worth it. But I've been able to print, trying to see if I have it here. I created my flyer on Canva and then I had Canva send me the pack of them. So I'm putting this up in the little side video here that I hope you can see. And whatever, it was like maybe $40 or something like that. Not too terrible versus having to download and then upload and take it to, Staples or a printing shop or whatever. Next up is constant contact. So in the world of email marketing or getting newsletters out or communicating, corresponding to people who sign up to learn about what you do, one of the things that we learned very early on when I was trying to build this practice and this business is social media is fine, but you can't always connect with people one-on-one. And sometimes you don't have access to their email addresses or their real names. But in the case of email marketing, whenever somebody shows up to something that I'm doing, I immediately hand them a clipboard and say, could you fill this out and give me your information? Because I'll add you to my mailing list, my distribution list, my email marketing distribution. And so what that does, it allows me to reach a wider audience blasting wise, and I can also segment and put things in lists. I'm not going to log in here because there's people's names and information on there that's private. But the reason why this is important to do is because the way that Gmail or other mail services are right now, there are rules and regulations about sending out too much and too many emails at once. So you can't just blind copy, 600 people on a Gmail address and send that out without it getting flagged for spam. At least here with Constant Contact, it provides me with a more secure way to send things out. And like I said, I can use their templates. I can send out, as a matter of fact, hold on. This is an example of what I was just talking about. So with the Constant Contact, send.com is the extension that kind of gets me through without coming across as spam. So if I use my own Gmail account or like a website address or something like that, but I had everybody's email in, a 2-line or don't ever send out 600 people's worth of emails in a 2-line because that's just crazy. Also inappropriate, maybe illegal. And you have one person hits reply all and you're done for the day. Anyway, so I could choose from a variety of different templates. I can create a newsletter. I can put images on it. I can add links, so things that I want to spotlight. And I kind of use this general template on here. So my Constant Contact, this is pricey. And as I'm looking at it, I wish it were cheaper than this because I don't, I mentioned, I think it was the other day about how I'm getting off of social media and I'm focusing more on YouTube because there's not a lot of conversion. Like not a lot of people are getting my stuff and then hiring me to do stuff or hiring me to do things. It's more of just a matter of like, I exist, here's what I'm working on. And, there's strength in numbers. I currently have about 2,000 people on my mailing list, which is nothing to sneeze at. This is, accrued over the course of the last 8 or so years. But how many of those people actually go and attend my webinars or pay for services that I provide? Very, very few. As a matter of fact, there is a general rule that you should try to aim for about 5% of that rate of return in order to say it's really worth it. I digress. Constant Contact charges me $58 a month to handle all of the newsletter emailing things. I really don't take advantage of that. I have to be honest, because I don't send out newsletters more than just once a month. As I'm sure you know from probably having subscribed to other people's newsletters or even like, stores like ShopRite, supermarkets, or Anthropologie, the clothing store, they're sending you like sales and discounts and check out our promotion. So I really try to be very, very particular, but I probably could take more advantage of it. I could probably switch to once a week instead of once a month. And then I could probably segment it out. So I'm focusing on different lists or categories or groups of people. Like I have interns, I have students, I have the general population, I have people who've provided me with information of very specific topics that they're interested in, so I could target them if I really wanted to. So TBD. CorpNet handles my business entity. So when I was first establishing myself as a legal business, and I'm not DishWithDina, that's the brand name. That's like the doing business as fictitious name. I'm actually Dina R. D'Alessandro, RDNCNPLLC. I don't know, it's this ridiculously long name because each state has their own regulations as to how you can create a business entity. So in New York State, they don't allow you to put like fake, like DishWithDina. That doesn't mean anything. They want to have something specific as to what your credential is, depending on your profession. Yes, I could have done this myself for free or for, not a lot of money if I went to like LegalZoom or one of these freebie sites, but I don't love messing around with stuff like this. This is legal documentation. This goes to the feds and the IRS, and it's very, very formal. So I hired a company called CorpNet. They took care of all of the paperwork behind the scenes. I think I paid them like a flat rate of whatever, $1,000 or something like that. And then every year they submit my business report and they renew my business entity on my behalf. And so CorpNet comes out to probably about, probably a little close to about $300 a year. So again, I'm sharing this with you. I'm assuming if you're watching this and you're interested in this, if you run a business or you're looking to get involved in private practice, these are things, some of these are very mandatory that you have to have, and other things are just, it's nice because you want to do it depending on the outreach you want to have or how specific you want to be in whatever it is that you're doing or what kind of direction you're taking with promotions, marketing, etc. But at the beginning of the year or every month or, towards the end of the year, this could really add up. So if you are trying to budget yourself accordingly, please make sure you're taking all this stuff into account. LinkedIn is free. I use the LinkedIn free version. So this is very cool because it's got all the links. You've probably seen this before. It's got all the links in one spot. So if I want to use something like a QR code, like I just showed you you see the QR code right here, I can use this QR code and it is static. It doesn't change. But when somebody scans this QR code on my flyer, they get to a landing page through LinkedIn, and on LinkedIn, I can change my links. So if I want somebody to reach out and set up a nutrition consultation with me, that link is going to be pretty much the same thing it is all the time. But if I want somebody to register for a monthly webinar, that's going to be a link that changes every month. So instead of always creating a different link or a different QR code, everything lives here and I just direct people in that direction. Okay, next up, my case. So I got signed out of this, not a big deal. This is a trademark business company that I hired. Again, I think this is about $1,000 as well to set me up as a trademark. So when you see my name DishWithDina, it now has a little R next to it, a little registered trademark, because I felt like it was important to brand that name so that nobody else could use it. And when you're doing things like branding or trademark stuff, you're in the, what is it, the like US attorneys something or other, and they're very specific categories. So I had to specify in there that I did nutrition counseling, that I did business coaching, that I did nutrition education. Like there could be a DishWithDina, I don't know, catering and culinary company. That's not what I do. So they're allowed to have DishWithDina catering and culinary, but they can't have DishWithDina nutrition counseling or anything like that. Next up is just a little, this is an example. So I do precepting with students, with official dietetic interns as part of our profession. We have to go through a year-long unpaid, you have to pay for it, internship. And so this is an example of one of the many internships that exist out there in NutriCo. So they do a variety of different things, but they also have the dietetic internship, as you see here. Their students will reach out, or their directors will reach out and try to secure rotations that their interns can go to get experience. And I will be set up as the supervisor, or what is known as a preceptor. So I don't get paid for this. And I also, if you're doing it legitimately, I also have to be trained to be a preceptor. So even though I know what I'm doing and I'm a business professional, they still want you to submit an 8-hour training that says you are aware of what the duties entail as a preceptor. So that's 8 hours out of my day. So it's not a money investment, but it is a time investment. And it's also a more long-term time investment because you're being assigned to, or you're being matched with an intern who might need you for 6 weeks, 10 weeks, depending on what it is that you're doing when you are working with them throughout the rotation. So it could be a food service rotation, a public health rotation, a private practice slash community slash clinical counseling rotation, whatever it is, that's time and energy that you're putting towards that. Okay, here's one example of what I mentioned before. I'm an independent contractor with the New York City Department of Aging, and specifically through PSS, which is the Presbyterian Senior Services. I just do monthly webinars with them. I get paid just 1 hour to work with them, even though behind the scenes, I'm putting together these very large research-based, but still general population friendly webinars. So I'm putting in about 6 to 10 hours of my time to create a product, but they're only paying me for the 1 hour that I actually facilitate it. Because it comes through the city government, because that's where their funds are eventually coming through the City Department of Aging, there is a portal that I have to go in here, and I have to upload certain things like my credentials, my license, and my, how I'm keeping track of stuff on there. And that's how they pay me. Okay, again, I kind of like in no particular order, I just opened up these tabs. So feel free to pause and take a break if you're tired of hearing me talking or you're not interested. The next thing here is an example of some of those continuing education units. Skelly Skills is just an organization that houses a lot of stuff that dietitians can use. So you can see here, there's courses by topics, diabetes, counseling, food, culinary. There's courses by formats. By CEUs, the more continuing education units something is worth, the chances are the higher of a ticket item it is. So sometimes I could get free to like $20 to get me 1 to 5 CEUs, but if something's about 30 or so, it's probably also a larger time investment, like an 8-week online course or a downloadable printed textbook that is upwards in the hundreds of dollars. So I've definitely done a lot of CEUs for free or very low cost, but if you want to get a little bit more bang for your buck and get rid of some of those things, or you plan on going to like an in-person conference and then taking some of these, training certifications, then, budget accordingly, both your time and money. Today's Dietitian is just an organization. They actually have I think it's still in print, a magazine. So it's not a membership organization, but they're related, they're affiliated with dietitians, registered dietitians. They hold, as you can see here, they hold symposiums. They also have some free and other CEUs, courses, etc. They hold live workshops sometimes too, if I remember correctly. So this is a great resource as well. Whatever it is that your profession might be, it might not be in the wellness world, health and wellness world. But again, I really do encourage you, if you're taking yourself seriously and you want to position yourself as an expert in your field, then obviously invest your time, energy, and money accordingly to continue learning, continue networking, and continue familiarizing yourself with the ever-changing field that you might be in. Next up is the Commission on Dietetic Registration. So this is the organization that oversees my credential as a dietitian. I'm not going to go and log into this because there's a lot of, specific information, my personal information on here. But whenever anybody first becomes a dietitian, we have to go on here for 2 reasons. Number one, we have to pay $70 a year to get the card that has our information. I guess technically you can call it a license number. And that allows us to be a dietitian across the states, across the country. Each state also has their own policies and procedures and regulations that you have to abide by accordingly. So while this is $70 a year for my national credential, I also have to go through New York State and or any other state that I want to be licensed in, because I'm not allowed to see patients in certain states unless I'm also licensed in that state that they reside. And then that's another $50, $100, $300, depending on what that state entails. On here too, this is where we keep our activity log. So this is where I upload my information and add my information for those webinars and those workshops that I'm going to in order to continue my cycle of my CEUs, my continuing education units. This is known as the CAQH. I never remember what it stands for, but it's got to do with health insurance. So if you are a practitioner, a healthcare provider, this is the kind of like the portal that all your information exists on, so that insurance companies can come and find you and decide whether or not they want to bring you on into their network. So you're getting credentialing. So in here exists many, many pages that you fill out, questionnaires, you upload your license, you upload a bunch of different other things as well. Locations, like if you have one practice location or you're working across many locations as well. I'm dying to remember CAQA stands for, why don't they put it on here? Okay, anyway, you can Google it. So in here, anytime anything changes or every year when something expires, I have to make sure I go back in here and reattest. So every 120 days or so, I get an alert from them saying, go back in and let us know if anything's changed. Next up is the Berry Street platform. So I mentioned before that I am my own private practice, Dina D'Alessandro Nutrition Counseling, but Berry Street is my telehealth platform. They handle all of the logistics, the credentialing, the coding, the billing, the payment, all that stuff. And they provide me with a HIPAA compliant telehealth portal. So I don't have to pay for a million different things and piece together stuff to do my business. I could just let them do it. It does come at a cost. I said, I think the other day, I'm happy to pay them a cut because my time is valuable and I get very overwhelmed being on the phone with insurance companies trying to figure out if patients qualify or eligible, or if I've been declined or denied in some way. I don't feel like dealing with that nonsense. So I let Berry Street do it all. ZocDoc. So if I were DIYing this, I don't remember what the cost is. I think it's something like $300 a year, depending on how big your practice is, but maybe it's even $3,000 a year. I can't remember. To be listed on ZocDoc. ZocDoc is like a directory that people go to look up for, practitioners. So I'm a registered dietitian. Does that even come up? It sometimes does not because people sometimes don't know what a dietitian is. But okay, well, anyway, you can kind of see here, there's different categories that are listed. Your insurance carrier, you can go and find, and then it shows up the directory. Because Berry Street does all of the stuff for me, they also do the marketing and the promotions as well on behalf of their dietitians. So I think they plug in a profile here, so I don't have to pay the subscription fee for that. Next up is eatrightpro.org. Technically, this is the Academy of Nutrition and Dietetics. They are affiliated with that CDR, wherever the CDR is. There we go, the Commission on Dietetic Registration. So this is the commission, the organization that oversees my credential, but this is the membership group that's affiliated with my profession. If I wanted to, I could pay a yearly fee, somewhere around 100 and something to 200 something dollars, just to be a part of the Academy of Nutrition and Dietetics in order to access their member specific resources. But they also advocate on behalf of the whole profession anyway. So even if you can't afford it, or you want to take a little bit of a break and not be a member of this, you can still access certain things. You can still see what's going on behind the scenes as far as legislature and things like that. You just can't download some of the stuff or get a discount if you're attending, conferences. Okay, one of the other things I wanted to share, was this, Healthy. So Berry Street does the portal, and we utilize what's known as an EHR, an electronic health record system, that, let's take a look at the pricing of it, that if you're starting out as a private practitioner, they have some cost-effective features and platforms that you can pick and choose from. So if you're just starting out, again, it's HIPAA compliant. We're dealing with people with medical conditions who might be sending us messages that are specific to their, eating disorders or their lab values. They might download something from their doctor. We definitely don't want that out on like a Google Drive or via regular Yahoo or Gmail accounts, like at all. So definitely invest in something like this to save you from getting sued later in life. And you can see there's different categories here as to whether or not it's affordable, or you can upgrade stuff. And if there's, other features that you enjoy on here too. So Healthy is the electronic health record platform that we use. Okay, next up is my website. So my dishwithdina.com website. This is behind the scenes of all the things that I do. So I can add my blog posts. I can have different pages, like an about page or an event page. And this is through wordpress.org, I believe, just to host or house, I think it is, the content and stuff. This is $19 a year. And then kind of like the business end of it, I might be getting this wrong because I forget. So I hired somebody to do this for me, so I forget what it is. But the business end of it, to keep like the domain running, is under a company called Flywheel. So this is Flywheel. Flywheel is $150 a year for whatever they do. I can't remember if it's hosting. They host my website. How does it work? It's kind of like GoDaddy, I guess. That would be the affiliate or similar to it. And then Jess Creatives is what she's known on here. She's kind of like the go-to web designer for dietitians and healthcare providers and wellness professionals. She's really, really good at what she does. And I'll be honest, it was a high ticket price, but with that came a lot of hands-on consulting. She took her time developing a very personalized look to my website. As I shared, I think in yesterday's vlog, it gave you a little bit of a look on here as to what it looks like and how she created it for me to have exactly what it is that I wanted on there. But she also does a lot of follow-up things. So like every quarter, she'll send out an email and say, do you guys need anything? So we can jump on a 15-minute call and say, where was I supposed to do this? Or how am I supposed to change this? Or this thing got wonky, or I screwed up, or something got updated in like what they call plugin. And if something gets cuckoo there, she can jump in and help with that. So again, this is kind of like lifetime, right? So my investment upfront for her was in the thousands of dollars, and she has been very worth it. And I love her dearly. She's very good at what she does. The next thing here is Availity. So this is also related to health insurance. This is just an example of a portal of, I think this is related specifically to Aetna, if I'm not mistaken. So if you feel like you want to be involved in insurance, and by the way, if you're not watching this as a healthcare provider, I hope you find it interesting just to know what it is that your providers do, or especially if the private practice practitioners that you go to who run their own thing, all the moving parts behind the scenes here. So Availity is the platform that you're looking up to again, to learn about eligibility, and to, I think you might have to also submit some stuff on there too for them to confirm you. Again, the different insurance companies have different ways of doing things. HPSO, I forget what that stands for too, but this is my liability insurance. Every healthcare provider is required to have insurance because, you know, we're working with healthcare, we're working with medical stuff. If something happens, if I accidentally give somebody wrong information, or there's a data breach and I get sued, this covers me up to like, I think $3 million or whatever worth of claims. So that is, I think, $108 a year. So every year in January, I just set it up for auto renew through my business banking account, and that takes care of that.
This wasn't the most exciting, I recognize, vlog of this week, but it is a necessary part of what we do when we are working like this, when you are an entrepreneur, when you're running a business. And a business can be a mom and pop shop on the corner of a busy street in the middle of suburbia, and it can be stuck in a room for an entire 14 hours a day, just trying to get all of your email correspondence done and catching up on all of the licenses and logistical things. If you have the luxury of hiring a VA, a virtual assistant, or an in-person human person, people, anybody who can be part of your billing department or working as an assistant for you, by all means do it. But I do think it's very important to understand how things work behind the scenes so that you can better manage your business. And just like anything, you know, you kind of get trained along the way as you step up, as you get more busy. You know how to manage and how to oversee and what things like this entail. So yes, leave it up to the experts, which is why, like I said, I work with that telehealth platform so they can do those things, and I can save my time to counsel my patients. But I've also done it before as a DIY on my own, and I recognize I don't want to do that anymore. So that ends this week in the life of Dina D'Alessandro, Dina the dietitian, Dish with Dina. I hope you found this interesting. Every day was a little bit different, and that's, again, kind of what I like about my job. I don't like just showing up to one thing, punching in, punching out, and being like, wah, that's all I got. But it's not for the faint of heart. A lot of moving parts, as I keep saying during this week, a lot of brain switching, functions, language, personalities, populations, and tax season is never a fun time because I have to collect a lot of documentation in order to do my taxes. But that was a little bit behind the scenes of what I do. And I might do this again. This is kind of fun. Also, like I said earlier, for me too, just kind of document all the stuff I've been working on and see how far I've come in the 9-something years that I've switched my career to become a dietitian. So thanks for hanging out with me. Have a great weekend and hope to see you again soon.